Hi, welcome to Mama Chill. So this is a prenatal yoga class, so for all of you pregnant, soon to be mummies, or maybe mummies expecting a new addition to your wonderful families. This is a fairly relaxed and gentle flow, so we're not going to be doing any standing poses today. It's going to be mainly on the mat. And really encourage you to take this at whatever pace feels good for you. So if there are things that you want to just miss out completely, or things that are not feeling good in your body, then by all means really listen into what's feeling best today and go with that. So usually when I'm teaching prenatal classes in person, I'd get you to fill out a medical history form. So seeing as this is recorded, please check with your midwife or your GP and make sure that you haven't got anything, any complications or anything that might mean that, that a pregnancy-specific yoga class wouldn't be okay for you. If you're experiencing any discomfort in your hips or in your sacroiliac joint in particular, so that's kind of at the back, or in your pubis at the front, then I'll give you options for anything that's wide-legged to have an alternative. So, again, listening into your body, checking in that this feels okay for you. So some props will be really good today. If you do happen to have a yoga bolster, most of us don't, so don't worry if you haven't, then you can certainly use your bolster if you have one. And really taking care, if you are using a bolster, they're super heavy, so being mindful not to strain or stretch anything as you move it. If you haven't got a bolster and you'd like to have an alternative, then what I'd suggest is grabbing a pillowcase and then shoving in. I mean, I've got 2 pillows inside here, but to be honest, if you can fit a third one in there, as much as you can bulk it up as possible, and that makes a really good alternative for a bolster, and then you can use it to sit on and support yourself. So yeah, if you want to pause the video and get yourself ready with one of those, that'll be super handy today. So 1 pillowcase with 2 to 3 pillows stuffed inside, or as many as you possibly can get stuffed inside. So definitely one of those. And then if you've got a couple of blocks, then a couple of blocks will also be really handy. If you don't have blocks, then if you've got something that could be used as a replacement, so you might want to find like a little stack of books that you can maybe bind together, or a couple of shoe boxes that are filled with books or heavy things, but it will be really, really handy to have those. If you really can't find anything else for these, it's not the end of the world, but just grab as many cushions and pillows as you can so that you've got lots of extra support. And I'd suggest a couple of extra pillows or cushions anyway would be really, really good. So, you may be early on in your first trimester, you might be really near the end of your 3rd trimester, and little babies coming along soon. So wherever you are, be really mindful that your body may be, feeling and looking completely different to someone else's body, depending on where they're at in their pregnancy. So I'm in my 2nd trimester at the moment, fairly early on. So what I'm able to do with my body might feel quite different to how your body's feeling. So please don't feel like it's got to be the same or look the same or whatever. So really be encouraged to go with what's feeling good for you. Maybe you've already got your gorgeous baby bump, and you've got to be a bit more mindful with that. So wherever you are, congratulations. I hope your pregnancy is going well. And really listen into your body during this class. So once you've got yourself set up with your props and your bolsters, and whatever else you might be wanting, we're going to come to start in a kneeling position. So I'd suggest that you grab either your little homemade bolster and you're sitting on that, or maybe you want to have a couple of cushions or pillows, but this is the kind of position that you're starting in. So finding something where you can sit comfortably and where you can feel really supported. We'll be spending a few minutes here. So getting yourself all cozy and ready for the start of class. Maybe this is your first yoga class, maybe you've done yoga before. So if this is your first yoga class, then welcome. You know, taking it really easy today and listening in to what you need. So getting yourself ready in this kneeling position, finding some nice support, allowing the knees to be nice and wide, making space for your baby, and then seeing if you can find a little bit of length in the spine. Sometimes the shoulders can come forwards a little bit in pregnancy, so maybe seeing if there's a bit of space to open up the shoulders and maybe bring in your eyes to close. So if at any point anything doesn't feel comfortable, feel free to shuffle and move around. And maybe you'd like to bring hands onto your belly, connecting with your baby, having a few breaths here with your eyes closed. Inhaling, breathing into your body, breathing in through the nose, and then exhaling through your mouth. So through sort of softly pursed lips, allowing the breath to gently leave the body. And maybe noticing where your breath is coming into your body, maybe if it's up in the top of your chest, seeing if there's a little bit of space as you inhale to bring the breath deeper, filling the sides of your body, the back of your body. There can be real ups and downs throughout pregnancy, particularly at this time when maybe you haven't been able to see everybody that you want to be seeing. Maybe as you exhale, allowing some of that stress, some of that worry to leave your body through your breath as you breathe out. And as you inhale, maybe there's a good feeling that you'd like to breathe into your body for you, for your baby. As you're inhaling, maybe imagining that good feeling coming into your body and feeling every single corner, right from where you breathe in, all the way down to the tips of your fingers, to the tips of your toes. Reach in, baby. And then exhale, letting go of anything that you don't need today, anything that you want to get rid of. Taking a few more breaths in whatever way feels good, maybe carrying on breathing in that good feeling. Maybe exhaling anything that's feeling really difficult or stuck today. Or maybe taking these last few breaths to connect with your baby as you have your hands on your belly, whatever's feeling good for you. And then keeping your eyes closed if that's feeling comfortable. Maybe taking a few open and closes through your jaw. So really nice, big open through the jaw, looking as silly as you want. Really nice, big stretch. And exhale, closing your jaw. So taking a few of these, Feel free to make as many silly faces as you want, taking those really, really big stretches with your jaw. The jaw's really connected to the shoulders, the neck, so if they've been feeling tight, and also really connected to the hips, so if you've been getting any discomfort in your hips or around the lower back. So taking a few more stretches through your jaw if that feels good. And then allowing your eyes to gently come open when you're ready. And as you inhale, taking a big roll up to the top of, rolling the shoulders up to the ears. Exhale as the shoulders come down. So you can roll the shoulders forwards if you want, and then exhale, they come down. You can change direction. Maybe you bring the shoulders forwards instead. So whichever circles, whichever way feels really good for you. If you're feeling tight across your chest and shoulders, then maybe rolling the shoulders up and down feels really nice, getting open through the chest. And then bringing your hands onto your thighs. On your next inhale, sitting up nice and tall. And then exhale, tucking the chin, rounding your spine. So giving your back a nice little stretch, maybe if it's been feeling quite tight, especially if your bump's really coming along, it feels nice to be in this position. And then as you inhale, you can come back up to sit again, maybe broadening through the chest. So taking a few of these at your own pace, taking those nice long exhales through the mouth. And you can close your eyes here again if that feels really good. Sometimes it's easier when you're working with the body to have your eyes closed. And then coming back up to center, sitting tall through the spine. And if the eyes are already closed, allowing them to stay that way. If you'd like to close your eyes, you can bring them to close again. And on your next exhale, maybe imagining, looking at your pelvic floor. So maybe imagining that underneath, in the whole of that pelvic bowl, so front to back, side to side, there being a little piece of tissue paper. And that stretches from your pubic bone at the front. You can always have a little feel, it's that bone right at the front, all the way to your coccyx at the back. And then also going across from one sitting bone to the other. So that's a big piece of tissue paper in a kind of diamond shape. And as you're exhaling, maybe seeing if you can imagine opening out that piece of tissue paper and then lifting it up slightly. So not scrunching it up, but lifting it up, kind of a gathering up feeling. And seeing if you can get that gathering up feeling inside the body, like a little internal zip doing up. And as you inhale, you can allow everything to relax. So giving that a go as you exhale, seeing if you can get that gathering up feeling from your pelvic bowl. So from that whole diamond shaped area, from the pubic bone to the coccyx, and from the one sitting bone to the other. And inhaling, allowing everything to relax. Coming through one more time as you exhale, getting that gathering in and up feeling. And maybe you also get a feeling of the abdominals broadening. So getting a feeling of them tucking around the sides of the waist. And then inhaling, relax. Opening your eyes when you're ready. So that's a really nice little pelvic floor practice that you can do. You can do it seated or lying or standing. So it's a really gentle activation of the pelvic floor. It's not super intense squeezing or having to kind of hold everything and grip everything. But imagining that piece of tissue paper, wanting to lift it up, getting that gathering in feeling as you exhale. And then if you want to also add in this kind of broadening of the abs, so you're imagining the abs sort of broadening around the sides of the waist, and that engages all of your kind of transverse abdominal muscles. So those are the ones that are really good for supporting your lower back, and really nice if you're sort of trying to keep your abs engaged during pregnancy but without working them really hard. Okay, so whenever you're ready, I'm going to come into an all fours position. So if you've got a heavy bolster, okay, taking care to slide it out. Otherwise, if you've got a cushion and things like that, then they're a bit lighter, but sliding them out really carefully. So bringing the hands forward, sliding anything out of the way that's in the way. And maybe like me, you need to be walking the hands around really carefully, coming into your all fours. So in all fours, if you can, bringing your hands underneath your shoulders and your knees underneath your hips, so you've got lots of space, and seeing if you can allow the spine to be nice and long. So getting the crown of the head reach in as far away from the tailbone as you can, and bringing your gaze down to the ground in between your hands. And then if you'd like to here, having a little go at some pelvic tilts. So working again with that exhale to engage. So seeing as you exhale, if maybe you can draw the tailbone down slightly and just get a feeling of tilting the pelvis slightly. And then as you inhale, you can relax, so coming back to more of a neutral spine. So having a little go as you exhale, maybe you're getting that slight tilting in the pelvis. So it's a really, really tiny little movement. And then inhale, coming back to center. So thinking about maybe a piece of string as you exhale on your pelvis and somebody's pulling that piece of string down, so it's causing that little bit of your tailbone to pull down. And then coming back to center. And we'll work with that same idea now, coming through a nice little stretch of the spine. So pressing through the hands, tucking the tailbone down, and then rolling through the spine, bringing the chin down as well. So coming into a really nice stretch. And then inhaling, coming back to center. If you've done yoga for a little while, you're welcome to take a mini cow, but otherwise I'd say stay in center. And then again, as you exhale, pressing through the hands, tucking the chin, rounding the spine. And inhale, coming back to center. So coming through one more of these at your own pace, so whatever feels good. If you want to hang out for a little bit longer in this nice little stretch here, it's really nice for opening up the lower back in particular, if your lower back's been feeling really sore. And you can take a couple of hip circles if you want, or a little sway side to side. So seeing what might feel good for your body. Maybe it feels good to just stay in that stretch. Maybe a little move from side to side feels really nice. And if at any point your wrists are getting sore, then if you've got those blocks or your little stack of books, you can always come up onto these, and that just takes a little bit of pressure off the wrists. If you haven't got your blocks, then you can come on to making a little fist on your hand, and you can do it that way instead. That's a really nice way to take pressure off your wrists. And then coming back to center whenever you're ready, and allowing the knees to maybe come a little further apart if that feels good, or you can stay where you are. An option to come either into child's pose or into puppy dog pose. So coming into child's pose, bringing the big toes together, the knees are apart, and if you want, you can have a cushion here in between your thighs and your calves, and you're lowering back the hips onto the heels. And maybe you also want a cushion underneath the head as well. So option to bring a cushion here and then bring your forehead down. So that's a really nice way to open up the lower back. That's child's pose. If that's not feeling good in child's pose, you can take puppy dog pose instead. So with puppy dog pose, you're bringing the feet behind the knees, so staying in your all fours, and then coming down onto the forearms. Maybe you stay here. You can bring a cushion underneath the forehead again. Or depending on where you're at in your pregnancy, you might feel that you want to bring the forehead down to the ground and do a little opener here. So these are both really, really nice ways to open up the back. Nice little relaxing pose. So whichever one you pick, maybe the forehead comes down, maybe you're on forearms. You can use cushions anywhere that feels good. And maybe you're in your child's pose. So taking care wherever you are to leave space for your baby, knees apart, and taking a couple more breaths here. On your next inhale, really carefully finding your way back up to your all fours position. So coming onto fists again if that feels good, if your wrists are getting sore or the hands can be flat. And a couple of options here. So option to come through a little mini sun salutation, or if you'd rather stay with maybe moving the hips like before, maybe tucking the chin round in the spine, or being in child's pose or puppy dog pose, then that's okay. So with our little mini sun salutation, then starting off by taking that rounding through the spine as you exhale, and then inhale back to center. And then option here to bend the elbows and do kind of like a little mini press up. You may need your hands to come a bit further forward. So we're not coming all the way down to the ground. It's lowering down however far feels good for you. So bending the elbows and then coming back up. So you're welcome to skip any of this that doesn't feel good. And then coming back into your child's pose or your puppy dog pose. As you inhale, option to come through again. So separating the feet and then rounding through the spine. As you exhale, pressing through the hands, tucking the chin. Inhaling, coming back to center. And then option to take that little mini press up if that feels good. Bending through the arms, coming down part way and back up again. So if you notice when you're doing that maybe if you've got quite a big bump, if you notice the spine's wanting to dip, then it might be that actually staying, with your pressing through the hands, tucking the chin, maybe that feels better instead. And then coming back into your child's pose. On your next inhale, rising up, separating the feet. Exhaling, pressing through the hands, coming into cat. Exhaling back to center. Inhaling back to center. And an option if you want to take that little mini chaturanga, so that mini press up, lowering down as you exhale. Inhale, pressing up. So option to skip that bit at any time. And then coming back into your child's or your puppy dog pose. Inhale, rising up. So we'll come through that one more time. If you've done yoga before and you're feeling that downward dog's feeling really good, you can absolutely add that in if you want at any time. So as you exhale, pressing through the hands, rounding the spine, tucking the chin. Inhale, coming back to center. Option if you want as you exhale to lower down part way. Inhale, pressing back up. And exhale back into child's pose. Or if you want to take a downward dog, taking a downward dog. As you inhale, coming back up onto all fours. An option to take a few of those hip circles if that feels good. And then when you find yourself back in center, we're going to come into low lunge. So really carefully bringing the right foot forward in between the hands. You might want to use your hand to help you get it there. So you can absolutely use the hand and bring it forward. And then once you get there, it's quite nice if you've got your blocks to bring those underneath the hands just to relieve any pressure on the wrists. If you haven't got them, then don't worry too much. And then allowing a little bit of openness in the front of that left hip. And as you exhale, rocking back, bringing the blocks with you if you have them. And you can have them this way up if you want to stay nice and tall. And then bringing the toes up towards the shins, so flexing the foot. And then pointing your foot. So taking a few little flexes and points here. So if you haven't got the blocks, maybe you can set yourself up with a little stack of cushions. Maybe you've got your alternative to your blocks. Otherwise, you can always stay fingertips down if the fingertips can reach the ground instead. But it's quite nice to have the blocks if you've got them. And taking a few of those flexes and points. And then coming back into your low lunge, walking forwards, opening up through the chest if there's space here. And breathing into the front of that left hip. Sometimes that can get a little bit tight, seeing if you can find a little bit of space. And then as you exhale, coming back again and taking those points and flexes with the foot. So these points and flexes are really good for helping with if you're getting any swelling in your feet or ankles or legs. So they're really, really nice for that. And if you haven't got any swelling, it's a nice way to keep the blood moving and stop any swelling from coming up. And then slowly coming forwards again. Seeing if you can find that openness through the chest for one more breath. And then moving any blocks if you've got them, bringing your hands back down to the ground. Coming back into all fours, so really carefully bringing that foot back. So again, you can use your hand to help it come back. Maybe you can slide it back. And once you get there, if you want to take a couple of circles with your hips again, if that feels good, then feel free to do that. So being really mindful if you're doing anything exercise related in pregnancy that your ligaments are really relaxed, really open, it's really easy to overstretch. So feeling like you don't need to take it all the way today, just taking it to maybe 70 or 80%. And when you're ready, bringing that left foot forward. So again, feel free to use your hand to get it there, taking a few little steps. And then if you've got your blocks, you can use the blocks. Otherwise, you can come onto your fists if that feels better, or onto your fingertips. But if you've got your blocks, feel free to grab that extra little bit of support. It's really nice. And if there's space, then you can lean into that right hip a little bit, allowing the right hip to sink down a little bit. So again, not too much, just getting a little bit of opening. And maybe if you're on your blocks, you can open up through the chest as well. On your next exhale, rocking back, bringing blocks with you if you have them, and allowing the toes to rise, doing that little flexing and pointing with the foot on this side. So doing a bit of yoga in pregnancy is really helpful if you're wanting to have an active birth. It's really good for helping your figure to get back to normal after you've given birth as well. Great for circulation, for swelling, and for looking after your body in lots of different ways, but also looking after your mind. So emotionally and mentally, having a little bit of time to work with your breath and to maybe check out from any of the other stresses that are going on. When you're ready, if you want to, coming forward. So if you're feeling better in one position than the other, you can always stay and carry on with your foot flexing and pointing. And whenever you're ready, coming back one more time and take in whatever movements might feel good. One last time, coming forwards. And breathing into the front of that right hip, seeing if you can maybe open and broaden through your chest if you're holding on to the blocks. And then when you're ready, bringing any props and blocks off to the side. Hands come down to your mat. And then really carefully and slowly sliding that left foot back into your all fours position and taking anything that feels good here. So maybe hip circles, or maybe you want to do the cows and the cats again, so they're pressing through the hands as you tuck them round the spine. So having a few breaths to do whatever's feeling really, really nice, really good for your body. And then when you're ready, I'm going to come to sit. So maybe bringing the feet out to the side might be an easier way to do this. Walking the hands back and then come into sit. And then slowly bringing the legs out in front. So what I would say is that at this point while you're sitting and you're maybe easy to have a little shuffle, making sure that your bolster or whatever your bolster replacement is nearby and to the side. And then also seeing if you can grab your blocks or whatever you've got as your replacement for your blocks also to the side. So maybe that's blocks, maybe that's cushions, and getting everything kind of ready so that it's quite easy for you to grab for later on. Okay. And then coming back to sit. So if it feels comfortable, so if you're not getting any pain in your pubis area, if you have got any pain there, then bear with me for 1 second, I'll give you an alternative. So if that's feeling okay, allowing the left leg to straighten, and your right leg comes in, opening up to the side. So your right foot's going to come against your left thigh. So if that's a comfortable position for you to be in, you can hold on to the foot, then feel free to be here. You can also sit on a couple of cushions and lift your hips up a little bit if you notice if your spine's rounding a little bit in that position. It might feel nice to have a little rounding if normally it's the other way. If this doesn't feel good for you in this position, then bringing both legs out instead and having them about sort of hips width or just wider apart. So if you've got any pain in your pubis region here, then that's a much better way to do it. So if you have got the foot in, You can always pop a cushion if that feels like quite a big opening underneath the knee. So again, making sure you're not overstretching anything. And then wherever you are, whether you've got both legs out in front or whether you've got one bent, inhaling and reaching up tall. Maybe your reach is a bit further in front if you've got quite a big bump or if your shoulders are feeling tight. And then as you exhale, coming into a little wave. So coming forwards as you exhale, out through the mouth, and inhaling, coming back up. Exhaling out through the mouth, and inhaling, coming back up. Maybe closing the eyes. Going with your breath. So exhaling as you come down in your wave. And inhaling, reaching up. So waves are a really nice way to look at contractions when you're in labour. Maybe imagining yourself as you inhale, the waves growing tall and the contraction is rising. Exhale as it releases as the wave comes crashing down. So maybe on your next exhale, you allow a deep sigh to come out of your mouth. Inhale, the wave is rising. Exhale, deep sigh. One more time. Inhale as the wave rises. Exhale, deep sigh. And back to center. Really carefully, if you've got that right knee out to your side, using a hand underneath the knee to bring it in, and the foot comes out. And then if it feels good here, bringing your hands behind your body, and maybe the feet have a little side to side rock in here. Maybe a little shake through the legs if that feels better. And then coming on to the other side. So you can either stay with the feet apart if that feels good with your waves in this place, or you can bring that left leg in, bringing the foot to the thigh. And if at any point, if you want to have your hands behind your back instead and just concentrate on your breath, you can always do that. So coming through that wave in again, option to close the eyes if that feels good. Inhale, reaching up. Exhale, breath out through the mouth. And allowing yourself to come through this wave at whatever pace feels good for you. Maybe you want to start adding those deep sighs out through the mouth as the wave rises. So this kind of really deep breathing is great for working with any sensations during labour, allowing you to feel grounded. I really encourage you especially if you're doing this at home and you're by yourself. To make as much noise as you feel like you want to here. Big deep sighs out through the mouth. One more here, reaching up tall as you inhale. Loud exhale. And back to centre. Really carefully bringing that left knee in, hand under the knee. And bringing the hands behind the body. So you can take the foot rock from side to side, or maybe you'd like to have the knees bent and maybe move the knees side to side. And whenever you're ready, coming back to centre. So you want to have a little scoot about halfway up your mat. And then maybe bringing the feet out to one side, we're going to be setting up a little bolster bridge. So I'll show you how you can do that. So if you've got your blocks, you're going to want whatever block is at the back to be higher, and whatever one is at the front to be lower. So that you'll get a kind of, whatever you put on top of it will be highest at the back and lowest at the front. So you can do this with bolsters, but you can also use loads of cushions if you want to sort of to prop it up with cushions, and whatever blocks you have really. So if you have even these kind of blocks, these work really well too. So you could pop them like that. So this is about whatever feels good. There's all kinds of options. And then if you have got a really heavy bolster, like I said before, sliding it and being really careful not to strain anything. You might need to have a little play around here to make sure that it's nice and secure, whatever you've set up. Oops. So, seems about right for me. So obviously if you've got your little stuffed pillowcase, you can use that instead. And feel free to fill, if you've got extra cushions, you can fill, or blankets, you can fill any little spaces. So, and then really, really carefully and mindfully leaning back. So using your hands to support you. And then coming back onto your little resting place. So this is lovely because obviously once you get further along in pregnancy, you can't lie down flat on your back anymore. This gives the feeling of support, of lying down without being all the way on your back. It makes it a lot easier to get up again as well. So it's kind of like setting up what you might set up for yourself in bed with a load of cushions behind you, but doing it on the floor. So like I said, you can use blocks or you can use a nice big stack of pillows. So you've got more pillows at the back and then less at the front, and then popping your little homemade bolster over the top. And from here, if you've got any pain in the front of your pelvis, in the pubic region, then you'll want to keep knees together. If it's feeling okay to have your knees apart, you might want to grab any extra cushions or blocks that you've got, bringing the soles of the feet together, supporting your with the cushions underneath your thighs and allowing the knees to open up. So this is called reclined Baddha Konasana or Supta Baddha Konasana in yoga. Reclined bound angle position, and it's a really nice restful position to hang out in, but you can absolutely have the knees together if that's feeling more comfortable for you at the moment. And then allowing your eyes to close, maybe hands come onto your belly, maybe down by the sides. Maybe it feels nice to have a hand on your heart, a hand on your belly, connecting you and your baby. So finding a position that feels comfy and cozy for you. If for any reason this doesn't feel good in any of those options, You can set yourself up with cushions leaning against a wall if you want, or against anything else that feels comfy. So this is just an option if it feels nice for you. And coming back through with those breaths in through your nose, if that feels good, and then softly out through your lips, through your mouth. Maybe noticing how your body's feeling, how that really, really chilled out class felt for you, what movements felt good, where's your body feeling good, maybe where is it feeling tight. Seeing if whatever your position you're in, if you can find a little bit of spaciousness, a little bit of openness. If this is feeling really nice in whatever position you've chosen, then feel free to stay here. If you're feeling like you'd be more comfortable maybe lying down on your side with some cushions under your head or cushion in between your knees, then feel free to get yourself into that position instead. So if you're coming out of this position, being really mindful, using your hands and to support yourself, your elbows to come up so that you're not using the abdominals, or rolling over onto one side first to come up. So really making sure that your body is totally supported. If you're comfortable in the position that you're in, then stay in here and allowing your breath to maybe come a little bit deeper. And coming back to those inhales and exhales you were taking at the very beginning of class. So maybe inhaling that positive thought or feeling into your body. And exhaling anything that you feel stuck, anything that's not serving you today. Maybe as you're inhaling, you hear the words, "My body knows what to do. My baby knows what to do." My body knows what to do. My baby knows what to do. Allowing your body and your mind to feel open to receive those words. Noticing how they feel in your body. How does it feel to be giving yourself this time today? To be making this important space for you, for your baby, just the two of you. This special time. Seeing if there's any more space for you to relax further, for you to sink further into all of the cozy support, the props, the mat that you've set up for yourself. How does it feel to have your body supported in this way? Maybe allowing yourself a little bit of movement in the fingertips. Maybe there's a wiggling of fingertips. If your hands are on your belly, maybe the hands rub the belly in a soothing way. Waking your body back up. And then depending on what position you're in, if your knees are open, bringing a hand under each knee, allowing them slowly to come together. If you're on your bolster bridge, maybe really carefully moving onto one side. And then using your bottom elbow, your top hand to help push yourself up really carefully up to seated. Coming up super slow, being mindful if you've got a bit lightheaded. Maybe you come into a cross-legged position, maybe you sit with the feet out in front, hugging the shins. Allowing space for your baby, bringing your knees to hips width or a little wider. Taking one more breath with your eyes closed, maybe slightly tucking the chin. And whenever you're ready, allowing the eyes to open or staying here for a few minutes longer. Thank you for practicing with me today. I hope that you've enjoyed this chilled out flow class, and I look forward to seeing you again soon. Namaste.